Are you getting a lot of questions? I mean, I know you're probably asking your patients that come in, have you been vaccinated? And if they say no, I just knowing you, I'm sure you're having conversations with them about, tell me more about that, and all of that, to get an idea of what the issues on their mind are.
Yeah. Yeah, I mean, a lot of it's the stuff that we just talked about. A lot of it is people that, were concerned about it being so new and not trusting that, that everybody that's talking about it has their best interests at heart. And so they don't know what to believe. It's not so
Yeah,
much that they think it's a bad thing. They just
yeah,
don't know what to believe because they don't know who to trust. They're not the people that think that it's going to put a microchip in them. They're the people that think, well, this is a new thing and there could be dangers that we don't know about. The problem, with explaining any of it is we've got 135 million people that now have these vaccines in their arms, and we can point to say these
yeah,
people have done a very great job of surviving. It's actually, and that's another point, in terms of the CDC guidance, the 135 million people is what it took for the CDC to be able to say, yeah, there is actually a 99 or 96% protective effect from these vaccines. And yeah, you can take your masks off when you're outside. That's the reason why it changed, because we've had 4 months or 5 months in some cases of people being completely
yeah,
vaccinated. So when we have that level of data and we can communicate that to patients, it mainly the answers to the questions are the epidemiology, and that's the problem is that there's so many physicians that just aren't familiar with it or aren't comfortable with it or don't know, and so there's a lot of information out there that just gets kind of left on the table. And then obviously the soundbite takes over. Well, you do this or you don't do that, or they just want an answer. They just want, tell me what to do, and that's not how this works, unfortunately. And that's the real issue.
and I know as a physician, you deal with this every day, where you have to take, the broad scientific studies and look at the data and
Mm-hmm.
whatnot, then take that sort of higher level population data and information, and then drill down and look at how does it apply to my patient sitting in front of me, because you have to take into consideration their particular risk factors and what
Exactly.
they're doing, and then tailor that guidance to them.
Absolutely.
Yeah,
Absolutely.
for
I mean, that
sure.
is that is the core of, you know, when I tell patients what we're dealing with, the CDC guidance is not for you, it's for everyone.
Yes.
To get your guidance for you, come talk to me or talk to your primary care or talk to the person that is able to know your situation specifically and apply those principles in the right way. And that's true for COVID, but it's also true for diabetes and for, just
Yes.
breastfeeding moms in general. I mean, that's the problem with a lot of these questions that people have is, what do I do? And they don't understand that what the CDC and the WHO are saying is, what do we do? And that's hard because, well, we should be well, kind of. But they're trying to give blanket information that is
Yeah.
usable by everybody. But there are some situations where that doesn't cover the whole situation, like you said. And so that's really what I've been trying to explain is you really have to have that individualized conversation to
You do.
get the information. You can't just go to the CDC. You can't just go to even to the health department. I mean, the stuff we're putting out is population based. It is not individual specific because we can't look at every single situation. So that's been
You're exactly right. We have to give out the broad guidance, the broad information that covers the whole population. And unless you can, as an individual, clearly discern what applies to you and how to use that information, which
yep.
is why in public health we always say talk to your healthcare provider, because they're
Exactly.
going to help you sort it out. Uh,
Exactly.
and so I think that's a good strategy for anybody.
Yeah, I totally agree.